Thank you very much. I'm going to venture a little bit outside of my areas of expertise, but I hopefully won't stray too far from what I consider to be the essence of that stray. I'm a sociologist who was trained in criminology, who then went to law school and found law school to be too restrictive, and found a very conducive and academic home in public health and medicine and their approaches to studying violence. I'm still studying violence. I'm writing a book right now on high rates of violence among African American males, which incorporates a lot of different perspectives, including not just sociological perspectives, but psychology, developmental studies, and a variety of other approaches. So I'm still working on that, but I'm going to take a little bit of time to do a kind of retrospective. And the reason why I want to do this retrospective is because of the great influence that some of my colleagues in sociology who study the sociology of knowledge, who study the sociology of medicine, and who study the sociology of science have had upon my work. And Mark Rosenberg addressed that this morning. One of the things that they always remind us of is that science, medicine, and all knowledge are social institutions. To the extent that they exist in a social arena, a society, they're going to be impacted by all of the social forces that impact everything else in a society. So politics, ideology, all the kinds of constraints that impinge upon every other aspect of society impact on astrophysics, chemistry, biology, medicine, the whole gamut of the sciences. So my speech in some ways reflects that. And in some ways I'm using the AIDS epidemic in contrast to the youth violence epidemic to illustrate that impact of cultural and sociological forces on the very sciences that we're trying to create as objective, non-biased approaches to studying social phenomena. Let me just start with a little quip about what I thought of when I started to look at this topic. I said, well, look, I'm doing a retrospective, and it's been a long time since I studied this, and I went back and started thinking about my first exposure to public health approaches and et cetera, and I realized it was about 34 years ago. And I thought to myself, wow, you're getting old. And I didn't quite use the word wow. It was a slightly different word I used, but the realization was that I was getting old and that hopefully I was learning something. And then I thought of Bob Dylan, Bob Dylan's song in which he looks back on his past and he says the following: I was so much older then, I'm younger than that now. Yeah, in a twist of phrase only Bob Dylan could do. So hopefully I'm younger to the extent that I'm really pleased to see the great amount of progress we've made in the science of the study of violence in the last 35 years since I began. I was here in Washington, D.C. in 1983 for a meeting of NIMH and the National Association of Black Social Workers that sort of kicked off some of the youth violence work that came later. We got some initial funding that was later shifted to CDC, and I think that was my exposure to sort of shifting out of sociology. But let me start with a few anecdotes that I think might illustrate, then I'm going to try to quickly go through the slide. You're going to have the opportunity to look at the essence of what I have in this slide on the website. It is much more detailed. It is much more verbose in content than the pictures you're going to see. But hopefully you can look at that and you can get more of essentially what I'm talking about. Let me start with a quote from the 1960s. In 1965, H. Rap Brown said, in response to Martin Luther King's efforts at nonviolent change, he said, look, violence is as American as apple pie. And a lot of people cast that aside as a kind of, militant rhetoric, but I think there's some truth in that. And I think that what we've discovered over the last 30 to 40 years is perhaps there's some truth in what H. Rap Brown said. Let me give you another anecdote. In 1979, I was beginning to write up my first academic articles about homicide rates among African Americans. And as a sociologist, you always go to the big three, Durkheim, Marx, and Weber. And so I went to Durkheim, and Durkheim had some insights about suicide and homicide. And Durkheim said that homicide rates and suicide rates each stem from the same kinds of social and psychological forces within a society, particularly in modern society. However, one of my colleagues there in the department said, oh, you don't have to worry about Durkheim. The fact is that older white men commit suicide and young black men kill each other. And so, again, a reflection of the kind of biases we bring to the study of truly scientific phenomena. Another instance was in the 1990s. Mark Rosenberg invited me to a conference at CDC talking about violence, and the rates of violence were really escalating among African American inner city males, and the rates had not escalated among white males in terms of school shootings. This was right between those two episodes of violent upsurges. And I made a presentation, I think Mark might remember. I said, look, we're not experiencing an epidemic, we're experiencing a pandemic. To the extent that violence is spread all across the American social arena. I mentioned domestic violence, I mentioned youth violence, I mentioned all the kind of militarism we have in society, et cetera. I said, look, you know, perhaps again reflecting Brown's comment that violence is endemic to American society. And then right after that, of course, we had Jonesboro, we had Columbine, and I think people started to ask quite a few different questions about the nature of violence in American society. Now, I'm going to shift into I'm going to come back hopefully for a few concluding remarks if the red light is already on. But so I'll just go through this. The reason why I think we need to look at AIDS and youth violence is we have two very similar populations. Both are stigmatized populations. Initially, the initial victims were stigmatized, homosexual males who were seen as deviant, engaging in promiscuous sexual activity. We had inner city young people, underprivileged, gangbangers, all the stereotypes we throw at the kids. But right before it started, there was a period of kind of quiescence. There was movement toward rights in the gay arena, and there was not much happening, we thought. And I'll maybe in the question and answer period, I'll talk about that. The unseen epidemic that was emerging in the 70s that was not well noted in urban violence among African American kids in the big cities. By 1992, you can see that we were in the midst of both epidemics. Gun violence was starting to increase, even in the school arena. And it was not to the extent it would be later. By 1983, it's interesting, we already had identified the AIDS virus as the source of the epidemic. So relatively quickly, about a 3-year period. 1984, you can see we have some evidence of that having occurred, but the media attention to youth violence was still limited to a few big cities. Then finally, in 1985, one of the things that was, when you have a stigmatized population, one of the things that was required to bring sympathy and empathy are non-stigmatized persons who were affected by the phenomenon. So we had Rock Hudson who died. We had Magic Johnson, but in the meantime, the rates of youth violence are escalating. By 1995, there are 513,000 cases of AIDS. The epidemic is continuing. By 1996, there are some breakthroughs in medicine for AIDS. In the meantime, what we're seeing is the youth violence epidemic unabated to some extent. We have the Columbine shooters. We have later, of course, in recent years, Newtown, et cetera. And we have 47,000 new infections of AIDS. The AIDS epidemic has now shifted from a predominantly white gay male population to a predominantly African-American population and Latino population, and disproportionate concentration of African-American females among those victims. So an interesting shift in both epidemics. And in my larger presentation, which you'll find online, I argued that one of the things that's happened is that perhaps there's some lessons we can learn from comparing these epidemics, that perhaps the initial victims are not good proxies for how the course the epidemic is going to take later. And sometimes epidemics shift, as they did in both of these instances. And I also noted at the end of it is that one of the consequences is that we had a social control response to the youth violence epidemic, and that social control epidemic phenomenon was not evident in the case of AIDS. But I started my presentation on the first paper that you have online by asking the question, what if the epidemic in the AIDS arena had progressed at the same pace as the scientific developments in the youth violence arena? What would we be doing now with AIDS patients? An interesting question to ponder. What if the youth violence epidemic had progressed as quickly? Would we have as many youth locked up as we have there showing in 2013? Would we have the sort of epidemic of prison lockups that we have in the country right now? Again, all because science doesn't exist in a vacuum, it exists in the social arena. Thank you.